death in a British hospital. This corpse may be the victim of what a doctor has called a new type of plague, a plague that kills thousands of men, women and children every year, people who need not have died. The breakthrough that identified the disease was the result of a massive computer exercise. Tonight, World in Action presents a specially commissioned study which for the first time gives the figures that show the true extent of the killer disease. A disease called unemployment. One of the many to face the reckoning was Harry Dias. He tells us what happened when his son Stephen failed to find a job.
I went out on a Friday morning and came back about 4:20. Knocks the door, the front door, no answer. Looked through the front window. Couldn't see him there, television was on. So I walked round the back, and the back of the house come through the back. He'd either gone out or he'd gone for a lie down and nap, you know, because he was doing nothing all day. And I walked up the stairs, and there he was, hanging from his bedroom door.
Stephen Dias hanged himself 2 days before his 17th birthday. New research methods have shown that Stephen's death may be only one of thousands resulting from unemployment. Professor Harvey Brenner.
We can observe, graphically, we can observe with statistics, that each time unemployment increases in virtually any area of almost any important industrialized country like Britain, for example, there follows, sometimes very quickly, sometimes within 2 or 3 years, a much more highly elevated rate of death.
America and the School of Hygiene and Public Health, Johns Hopkins University. This is where Professor Brenner has been researching the effects of economic change and unemployment on health. Professor Brenner argues that though people may think of suicide as the only cause of death linked to unemployment, there can be other, less obvious effects. Feeding vast collections of official government statistics through his computer, he's discovered that heart attacks, strokes, liver disease, mental illness, crime, and even murder all increase as the unemployment rate goes up. 15 years ago, he began his research by looking at mental illness. His findings were greeted with disbelief and hostility. Today, his work is generally accepted in the States and has radically altered the way Americans now look at unemployment. World in Action went to America to find out what his work involved. 2 years ago, a special report was commissioned from Professor Brenner by a congressional committee chaired by Senator Hubert Humphrey. The report considered the social costs of economic policy. Professor Brenner looked at the 1.4% rise in American unemployment in 1970 and worked out that it cost more than 51,000 deaths. We asked him if he was actually saying that unemployment killed people.
Much of it directly, probably much of it indirectly. But we're talking about unemployment as a risk factor in mortality among several others. And with every risk factor, like smoking, like air pollution, like poor diet, which increases the mortality rate, so also does declines in income, and particularly those declines in income that are related to unemployment. So the most direct answer to your question is yes.
Liverpool, a British city well known for its high unemployment. World in Action invited Professor Brenner to study Britain and 2 individual cities. Liverpool was the first. Professor Brenner was shown round the district of Speke by local community worker Maureen Williams, who knows exactly how many jobs have been lost and where.
This Barber Threads at one time, not so long ago, was a place called Whitley Lang and Neal, which was precision engineering and used to employ about, well, in excess of 200 men. And the factory closed. This factory here at one time was employing over 200 people, and they had a building across the road as well. They now have got a workforce of about 24. Plessis, that's gone completely. As we go up here over the bridge, we're coming up to the most spectacular closure we've had recently in Speke. Just over here is Standards number 2 coming up. See this massive grey edifice,
Yeah.
and we lost 3,000 men. It's number one, where they want, what, another 500 redundancies they're asking for at the moment. Dunlop's has been associated with Speak for over 30 years now, and at one time it was employing something in excess of 12,000 people. Now it's employing 2,400, and they're under threat of closure.
In the mental health area itself, then, relating to the stress of unemployment, what are you observing there?
Unfortunately, so many women are on tranquilizers and sleeping tablets, and one can't blame them or say they're being weak and inadequate, because they're doing impossible jobs trying to cope with families with no job prospects for young people. I mean, the strain on a mother, you know, with a 16, 17-year-old, and she sees the kid leave school full of enthusiasm, going down to the dole every day or so, and then after 3-4 weeks, 3-4 months, the kid's not interested. Imagine what that does to her. And then you get a situation where the father's out of work as well, and so on.
In Nottingham, the other city that Professor Brenner studied, the harmful effect of unemployment was confirmed by Dr. Alfred Minto, a consultant psychiatrist.
Well, this hospital here has got about 450 to 500 patients in it at any one time. When I looked at the male patients of employable age who'd been admitted in 1975, over 40% of them were unemployed at the time of admission. So clearly there is an important relationship between the two states. It's difficult to judge exactly what the details of it are, but it must be clear that you're more likely to be admitted, as far as I can see, if you're unemployed than if you're in good employment.
Nottingham, where Dr. Minto works, was chosen for the study because its unemployment rate is generally below the national average, and it's considered to be a prosperous city with few employment problems. But even Nottingham shows signs of depression. While there are no spectacular closures like Liverpool, work is increasingly difficult to find. Armed with details of employment, unemployment and death rates, Professor Brenner and his team returned to their university in America and began assembling the material that was to lead to surprising new findings on the human cost of unemployment in Britain. But first we wanted to know how his team worked and whether the statistics couldn't be adjusted to fit anything he might want them to say.
Well, theoretically that's possible for any researcher, of course. Since we have been working with this kind of material for many years, we've developed a series of techniques to expressly prohibit that. For example, we have different groups of researchers working at each level, so that no one team or one individual is influential all along the line. The group of people who collect the data are entirely different from those who transcribe the information or who enter it into the computer.
How you doing? Hi. Okay, what we're doing now is total cancer mortality for the counties. It's the same format, just type the county name first, and then on the next line put cancer mortality for males, and then skip a line and put females.
Oh,
okay?
I see. Okay.
And the order, and use these code names, okay?
Okay.
Okay.
The people who enter it into the computer are different from the ones who prepare the analyses.
Mike Ormiston is Professor Brenner's computer programmer.
Well, I punch in the data, punch in the equations, and then there's the computer. I ask the computer to make the appropriate calculations. And there's a little dialogue we have between the computer, and it asks me questions, and I answer the questions. Sometimes right and sometimes wrong. Then I tell the computer to go and do the estimations, tell me how much these variables affect mortality. And if it's good, then Dr. Brenner looks over the results with me, and we analyze the results.
The ones who prepare the statistical analyses are again different from the ones who interpret the material. or who give the initial instructions as to the type of mathematical equations to put in. So it's very difficult with this series of checks and balances for any one individual or group to influence the material greatly. Another very important set of checks is that we come up with very standard equations that can be duplicated, that can be repeated by scientists elsewhere.
In Britain, few consultants in community medicine have been concerned with the effect economic policies have on the nation's health. Dr. Peter Draper, director of the Institute for the Study of Health Policy, is one of the few doctors in Britain to know and take a keen interest in Professor Brenner's work.
Well, I think it's extremely important. It's very carefully done work. It's essentially statistical association, seeing how this is changing compared with that and so on, and allowing for a whole lot of other things changing at the same time. It's precisely the kind of work that led us to realize the importance of smoking in relation to lung cancer and the other diseases. So potentially very, very important work. And of course, there is other kind of research which substantiates this. We know from studies of people who are going to be made unemployed, and we know from work on stress that there are very good explanations on individuals of how these how unemployment can actually kill people.
In America, Professor Brenner and his team had finished processing the British data. Would England and Wales show the same relationship between unemployment and death that had been discovered in the United States? The first graph to come off the computer was for Liverpool. The solid line shows the death rate between 1952 and 1973. And the dotted line shows the number of people working at any one time. The telltale pattern that Professor Brenner was looking for was there. As the jobs curve plunged down, the deaths curve went up. The match was a good one. This is the pattern to watch for in the following graphs. Next off the computer was Nottingham, a city with less unemployment. But again, as the jobs curve went down, the death curve went up. Was the same true for specific illnesses, chronic liver disease, for example, like cirrhosis?
If we look at the entire country, all of Britain, and look, for example, at cirrhosis of the liver mortality, almost entirely affected by very heavy alcohol consumption, and as we are finding typically under stress conditions, we can see by eye graphically that with a decline in employment, within 2 years there is a rather dramatic increase in the cirrhosis mortality, and that will happen every single time, every year, that employment falls. 2 years later, we will almost always see an increase in the cirrhosis mortality. It is true as well for suicide. Now, suicide reacts very sharply. Suicide reacts so sharply to declines in employment that it is virtually a good indicator of the state of the economy. Nearly every time employment falls, suicide will increase within the same year.
People dying from liver disease, heart attacks, suicide, even from murder, these aren't just computer pictures. They're accurate and disturbing evidence that rises in unemployment are almost automatically followed by the death of people who might otherwise have lived. Comparing his American results with those for Britain, Professor Brenner was surprised to find the relationship between death and unemployment so strong in Britain.
The reason I was surprised is that, of course, Britain is quite famous internationally for its excellent National Health Service and its very extensive welfare system. And certainly members of my staff and colleagues in the professions involved led me to believe, and believe themselves, that this would certainly affect the mortality patterns. Well, as far as we're able to determine, welfare, for example, in Britain does indeed act as a protective device against the mortality that might ensue from reduced income. But even holding that constant, the relationship between declining income or loss of employment in Britain is somewhat stronger than it is in the United States.
The resulting deaths aren't just confined to the unemployed, but are spread right across the community, affecting old people and young babies, those in work as well as those out of work.
very interesting finding, which we did not originally expect, but which later became very clear, was that the self-employed, that is, counties that have a heavy proportion of self-employed, in addition to having a heavy proportion of unskilled and semi-skilled workers, have a much greater chance of showing much higher mortality. And this seems to be associated with the great vulnerability of the small shopkeeper, for example, or the individual who has a client who himself becomes unemployed. So in areas generally where unemployment is rampant, where there are large numbers of people who must leave the area, the local shopkeepers are in a very difficult position, and they too suffer very greatly, possibly as greatly as the unemployed themselves.
While Professor Harvey Brenner was in Liverpool, he met a group of workers who'd been living with the effects of unemployment for some time. Dockers, textile and car workers, employed and unemployed. Despite the professor's specialist language, there were no problems of communication. They recognized what he was talking about.
Groups with the highest rates of unemployment and the lowest levels of skill and lowest levels of earning have shown the highest levels of death.
We've had experiences, I know personally, as a senior shop steward, where I know a guy who worked for us. The chap had been made redundant 5 times in a matter of 11 years. And he died of a heart attack at the age of about 42.
The thing that amazes me out of all the statistics that Harvey's produced is the fact that it runs right across the whole of the age group. People who've never been employed, child mortality goes up. Retired people, so it's you know, it can't possibly just a question of the way it affects the people at first hand unemployed. It starts to affect people outside their families, people who are into retirement, infant mortality, the whole ruddy lot. It's not just a question of the people who are actually first hand affected. And I think this is the vicious thing, and this is the part that should be examined. You know, that we're not talking about people who are self-employed, it's affecting them, or people who are actually unemployed. It's affected right across the board. Infant mortality, how the hell? Well, who would have thought it could affect it? But the statistics prove that it does. People in retirement, the whole lot, are affected by it.
But you see, that there's one point, you know, like when I worked in the bottle works, there was a man of 82 years of age, and he used to religiously come into work 5:45 every morning. And when the bottle work closed, that man died because there was nothing there for him. He just dropped dead.
I had a similar experience with a fella. We had redundancies in our factory, you know, just over a year ago. And I had a knock on my front door one night, and a woman comes to the door, knocking on the door. She was nearly crying on the doorstep. She said, "Can you get my husband his job back? Since he's packed up work, you know, he's moody, he won't go out, he won't talk to me, he's shouting at the kids." And actually what he wanted to do, with the redundancy money that he took voluntarily, he wanted to pay it back, you know, £1 a week, whatever it was he could afford.
As Harvey says, and we're coming round to the fights and families, and we're arguing with our missus, or we're going to hit her, or we're taking it out on, you're becoming a tyrant within your own home, and you're driving your family away, instead of having them against you. Now, maybe the family itself don't realise, or the people of these families are not educated enough to say, well, that poor bugger's had a heart attack, that poor bugger's lost his job, that poor bugger's had to give up cigarettes after 30 years.
Everyone who's been to work actually gets help from other people, not consciously, but it's there. They learn to work together, to live together. And when, particularly young people, when they can't work, and they can't be in an environment where they have to relate to other people, then they've got problems. I mean, I know personally about at least 3 or 4 dockers, and other people, by the way, who've committed suicide because they can't cope with not being at work. They probably don't realise that's the reason, but they just can't cope with not being at work.
I know cases myself where people have died, you know, heart attacks, the wires on, you know, tranquilizers, Valium, you know, they're knocking on the door, bothering up next door. And these are the problems that we know about, deeply inward, you know, but it's never been brought out in the open. But these statistics prove that...
Once the work done by Professor Harvey Brenner had isolated the fact that every time unemployment goes up, so does death from a number of different causes, We wanted to know if it was possible to say exactly how many people had died. First, we asked Professor Brenner about Nottingham.
Each time the unemployment rate increases by 1%, from 3 to 4, let us say, we will have, on the average for the total population, an increase in mortality of over 2%. So even in a small city, relatively well-to-do, we will find that over 100 people died in relation to the increase in unemployment within that period of years.
But in Nottingham, between 1972 and 1977, unemployment increased by more than 3%, which means
over 300 additional deaths, and that's closer to the true figure, taking into account the true historical change in that city.
Professor Brenner then punched in Liverpool.
Now, if we only consider the number of deaths after age 45 in Liverpool in relation to a 1% increase in unemployment in that city between 1950 and 1975, we count 220 additional people who died with each 1% of increased unemployment.
But in Liverpool, between 1972 and 1977, unemployment increased by 4.9%, which means nearly 5 times those deaths. The real figure comes to more than 1,000. Because the number of people dying in Liverpool and Nottingham was so disturbing, we asked what price the UK as a whole was paying for its closures and redundancies. The following figures are a terrible new addition to what's known about the effects of unemployment.
We estimate that for the UK as a whole, between the years 1950 and 1975, an increase in unemployment of 1% is equivalent to a 2.1% increase in mortality for the country as a whole and for all of the age groups. But altogether, if we were to total up the number of persons affected by this 1% increase in unemployment, it comes to something on the order of over 17,000 individuals.
Again, those 17,000 deaths are based on a 1% increase in unemployment. Between 1972 and 1976, the actual increase was more than 3%. That gives a final total of more than 54,000 deaths. Did these deaths create a new responsibility for policymakers?
If it should occur that as we learn more about these things, and as this information does become available to governments who are in a position of decision-making, and they do indeed allow the kinds of levels that we are now experiencing, and make the active decision to take the consequences will be measurable in mortality terms.
So the very thing that Harvey is saying is that the stress that brought about by unemployment, that increases mortality rates and it increases sickness and all that, is increased even further by the way the whole country looks at the unemployment, a self-inflicted wound, they say. And yet, you know, in actual fact, it's inflicted by decisions in boardrooms, by decisions in governments, and decisions totally unconnected with individuals. But it's individual-based stigma that people responsible walk away totally scot-free. If the polluted are bloody, if they'd be brought to bloody justice. It doesn't happen when they create pollution of a whole environment on unemployment.
In the 19th century, public health people were bothered about prevention, bothered about things like getting sewage out of the water supply. We're concerned with the hazards to health today, and very often those hazards are things that are done in the name of economic progress, very often economic policy. We've got to think about massive unemployment in the way that people thought about the plague. This is a modern form of plague, and as long as people like myself, people within medicine, within health, say it's all right to let this happen to people, we are being party to letting people be exposed to a contemporary plague, and it isn't good enough.
Last month, almost 100,000 more people registered as unemployed. By next December, the European Community thinks nearly 2 million Britons may be unemployed. Some see that figure rising to 5 million within 10 years. Britain is already suffering the cost of past closures and dole queues, and more closures are taking place. Any further job losses can now be measured not merely in pounds sterling, but also in lives.